Hi, I'm Dr. Kannady with CLS Health, and I'd love to talk to you about overactive bladder today. If you are having accidents because you get that urge to run to the bathroom and you don't make it in time, rest assured, you're not alone. What we're finding is that upwards of 50 million Americans are having problems with urinary incontinence in the form of urge incontinence. There are two different types of urinary incontinence that we'll talk about: stress incontinence and urge incontinence. Stress incontinence is more of an anatomical issue where you physically can't hold the urine in when you laugh, cough, jump, or sneeze. That's treated more surgically or with pelvic floor physical therapy, and we'll talk more about in another video. Urge urinary incontinence is that urge, that sudden urge that you've got to run to the bathroom. If you don't run, you're not going to make it and you leak on yourself. It's important to know that the bladder is intimately controlled by the nerves in our body. Throughout the day, your bladder will fill with fluid, and when you're ready to pee, you will get a sensation that you need to go to the bathroom. Normally, we're able to control that urge, but when you have a bladder that's overactive, you're going to have more severe stimulation for that and you have to run to the bathroom. The problem with it is that over time it can get worse, and also if you are having leakage, that cost can add up because you might have to be buying pads, you might have to be buying new clothes because you're having accidents. And if it keeps getting worse and worse without treatment, that cost is only going to add up. So treating it early is always a good thing to think about. The important thing is there are many things we can do to treat overactive bladders and urinary incontinence. The first step is usually limiting fluids intake, also bladder training, lifestyle changes in the form of avoiding caffeine or things that make you urinate more often, including alcohol, and then eating a certain diet that can help take things out of your urine that gets filtered that would cause you to pee more. The next step is usually medications, and there are a wide variety of medications that we can tailor for your needs. The things that we can do that are more invasive include PTNS, or percutaneous tibial nerve stimulation, which is usually an in-office procedure with a needle that goes right above your ankle to help stimulate the nerve over a few sessions to help give you some relief in your overactivity. After that, we have things like bladder Botox injections. These are a great option, but it is a procedure that we have to do in the clinic or in the operating room to inject Botox into your bladder so that it helps calm it. This is a great procedure, but we do have to usually do it about every 3 to 6 months, depending on your symptom. That being said, it is a great procedure and very easily tolerated by most of my patients and with great outcomes. Now, if you're looking for something a little bit more permanent and you don't have to keep going in and getting a procedure done, it's sacral neuromodulation. So what is sacral neuromodulation? What it is we're basically tapping into the nerves that help control the bladder. They're going to help calm the bladder down. So the process for that is a two-step process. First is usually what's called a percutaneous nerve evaluation, which is PNE. That's where we tap into the nerves and we hook that up to an external battery and you test it out. We see how it works for you. Then we're going to get you scheduled for the next step, which is going to be the actual battery implant. So we do the same thing, we tap into the nerves, but this time we take the battery and we implant it into your butt or hip on either side. But it's important to remember that these are all outpatient procedures. You go home the same day and very minimal recovery very quickly to get back to your normal daily living. With sacral neuromodulation therapy, we have a very high success rate. Studies have shown that 93% of people have seen clinically significant improvement in their symptoms, and that's all the way out after 2 years. Also seen that 90% of those people are also very satisfied after 2 years. So I've had many patients who have been able to regain their social life and autonomy and have the ability to go out in public again with confidence that they won't have an accident, go on long trips, go to the movie theater, go to the grocery store, just live their daily life again without having these issues and having their bladder control their life. So let's get control of your bladder with any of the techniques that I've talked about, and let's get you back to your life again today. So come see me at my Heights clinic, my Galleria clinic, or my Memorial's Normal Life.